Okay, for me, Breast Cancer Awareness Month is a month where we talk about our breasts. We remind each other of the need to check up on our breasts, to know what's normal and to know what's not normal.
I think it's the month where we really just get hyped up with the hashtags Pink October, and we really get a lot of people rallying behind the movement to get the word out about breast cancer.
It's a month where people, the general public is educated on breast cancer, how to self-examine yourself to see whether or not you have it, the treatment and that sort of thing.
I feel like Breast Cancer Awareness Month is a really necessary month because we can easily forget to not do these necessary checkups on ourselves. And also it's a month that prioritizes us women and says, look, your health matters. Without your health you cannot be productive. So it's really mindful for us to be able to take care of our health. So for me, October, the month of awareness on our breast and cancer, it's a month to say, don't forget about yourself, don't forget that you matter, and don't forget that your breasts, the beauty of you, should be taken care of and checked up on. And immediately when you do see anything abnormal, you do something about it.
I think that there isn't enough awareness on breast cancer because throughout the whole year, October is the one month where we really get to have the conversations.
I do not think there is enough awareness because the only time that I get to know or hear about breast cancer is only October, but the other month is just quiet.
I think we have reasonable awareness on breast cancer. It's not as adequate. I believe we should be having these talks in schools. We should be having more of them in churches. Every now and again, our local radios should be talking about breast cancer because it's the second leading cancer that is commonly seen and people have.
And even in October itself, the conversations are quite limited. There's only a limited number of people and organizations that are spearheading the conversations.
I think it shouldn't be that way because breast cancer is just as important and it's just as deadly, and people need to be taught, like it should be an ongoing conversation that happens every time.
And it's so unfortunate that we have a lot of women who go undiagnosed and unfortunately find out at later stages that they have cancer, they have breast cancer, and it's too late to have some of these treatments.
If you look at HIV, it's something that people are still even raising awareness up until this day, and I think there's no one who doesn't know about it, but people are still talking about it. People are still being educated on it. So I think it should be something that is taken on a higher level and the conversation should be ongoing.
So I do feel like we need more information on the ground. We still need to keep talking about it because this thing will never end. It's something that will always affect some women or some men. So yes, I feel like we should have the conversation going. We should keep talking about it.
I think that it's important to raise awareness because just by being a woman, you are at risk of getting breast cancer. And there are so many women in our country, and each and every woman from a very young age, young women, need to know and understand breast cancer so that we are able to self-test and we're able to understand actually initially the importance of getting breast cancer screening or even screening ourselves when we are at home on a regular basis. I don't think that Zimbabwe is capacitated enough, because when we look at our health sector on a general note, Zimbabwe is not capacitated to treat other diseases, to treat normal ailments that all people suffer from. So for something as delicate as breast cancer, I don't think that we are capacitated.
Looking at our health sector, I would say no. Because when I was listening to the radio program, I heard that chemotherapy is like very, very expensive. And looking at how our health sector fails to deal with some of the illnesses and sicknesses that are already here, so I do not think it is capacitated enough to deal with it.
I don't think we have enough capacity as yet. As we all know right now, we're having challenges in our health sector. With our local hospitals, they had challenges with medication. They had challenges with accessing, necessary health services for not just the patients, but for the health staff. They don't have adequate equipment, so that also causes a lot of challenges, not for just the people who are affected, but also the health workers. So no, I don't think we have enough or adequate resources when it comes to our medical facilities here in Zimbabwe.
Having breasts, first of all, already puts someone at risk of developing breast cancer. And so it's very important that each of us understands what breast cancer is and how it can affect us, so that we can protect ourselves and also be able to check ourselves. And if ever we detect any signs of breast cancer, we're able to report to the nearest hospital or any medical practitioner and get help as soon as possible. Because by virtue of being a woman, it means you're already at risk of developing a breast cancer. So I think it's very important that we are aware, so we can protect ourselves and be able to get help as soon as possible.
Women should be mindful of a painless lump in the breast, especially in the early stages of breast cancer. The breast begins to change. Sometimes it grows and it looks like someone is breastfeeding and has those veins that look like an engorged breast. It goes on to change the skin outside the breast, and it will be looking like an orange peel, the dimpling outside the orange skin. Then it goes on to have maybe a sore or a wound, which could be fungating or not fungating sometimes.
Breast cancer is one of the most common cancers in Zimbabwe. In fact, breast cancer comes second after cervical cancer. So that on its own makes breast cancer a public health concern. And secondly, the reason why we must regularly screen for breast cancer is for their own good, allowing us to detect breast cancer in its earliest forms, so that we can manage those patients effectively and increase their chances of survival.
Keep your weight within the healthy body mass index. If you're obese, try to reduce your weight, because breast cancer affects people. When you are obese, you have a higher risk of contracting breast cancer.
And we know that a third of most cancers can be prevented by simple measures like eating a balanced diet. You see, in our present circumstances, you see that breast cancer is now rising, or cancer in general is now on the increase, because people have now adopted a Western type of diet. So we are what we eat. Let's eat balanced diet. Let's avoid eating fatty foods, fried foods, and eat natural whole grain meals like legumes, things that we naturally grow. And secondly, we should avoid alcohol. We know that cancers, most of them, are associated with increased intake in alcohol as well as smoking.
The biggest way to contribute, I would say, is to have conversations, to talk about it openly in the small circles and the bigger ones. to be able to understand what breast cancer is and ensure that as we go through our day-to-day lives, we don't wait until October to talk about breast cancer. We make it a part of our everyday conversations with our friends, with our families, and just keep the conversation going and spread whatever knowledge and information we have, and also encourage other people to get tested, to check themselves, and, you know, like I already mentioned, make it something that goes beyond October, which is the month of breast cancer.